Hello, everyone. This is Dr. Michael Bell coming at you again for another one of our webinar series. And today we're talking about inflammation and what we can do to overcome chronic illness and disease. So as I start out most of my talks, I like to always start out with some statistics to make this relevant to people. And when we look at the lifespan and compare that to chronic illness, we find that 1 in 2 Americans, or 50% of Americans, have some sort of chronic disease. Chronic illness is responsible for 7 out of every 10 deaths in the United States. And there are some pretty major ones that we've all heard of, but for what we're talking about today, we're not talking about specific diseases or treatments of specific diseases. What we're just talking about generally is chronic illness and how we can overcome some of these life-threatening issues. The first one, especially with our practice, is going to be arthritis, and 99% of our patients, or at least 90%, are going to suffer from arthritis. Heart attack and stroke is huge. Cancer is huge. Diabetes affects over 30 million Americans, and there are a lot of Americans who are obese. It's potentially even up to 40% of Americans would be considered clinically obese. So I have a saying in the office, and it's not original to me, but I always will say to people or patients, if you're sick and tired of being sick and tired, then there's a reason for that. And it's not normal for your body to be sick. Our bodies are actually made to be well. But there are some main things that I find that make people sick, and they can kind of be lumped into certain categories. And the main ones are going to be diet and poor nutrition. And like we've already said, a majority of Americans suffer from some sort of nutritional deficiency. Alcohol and tobacco use can be a major factor, as well as lack of physical activity. Most of our jobs these days are desk-based, or what they call sedentary. We function as a society mostly on computers, and so we don't have a lot of ability or time to do physical activity, which can also carry on over into stress, and jobs can be stressful. Our lives are stressful. Everything seems to always be in a state of flux. And so that's a major issue for almost every patient that is needing a program of functional medicine or needing to overcome chronic illness and inflammation. Hormones are huge. It's a very large component of a functional medicine program, is making sure that your hormones are balanced. We have all been exposed to viruses, bacteria, and molds. Depending on how you treat that or not treating it, in some cases can make you chronically sick. And then our environment, our work environment, home environment, chemicals we were exposed to at work, or chemicals we use in our hair. I mean, there's all kinds of things that can go into this environment thing. And it's kind of a dumping ground for all things that we talk about, but a lot of times it can be very key to helping someone is changing how they exist in their environment. So if you're sick long enough and you are sick too many times, your body starts to become compromised in terms of the immune system, this can lead to toxicity. And that's one of the major components of also functional medicine, is making sure that the body has its ability to be detoxified or detoxify itself. And in many cases, if you overload your body's detoxification systems, then you're going to have an incredibly hard time overcoming your ability to heal. So as our bodies begin to have an increasing level of toxicity, it creates some challenges, mainly in the digestive system, but also in our liver and our kidneys, and also our lymphatic systems. So these systems all work together to process the foods that we eat, to eliminate the waste products and the byproducts. And eventually, if these systems become overloaded or one stops working correctly, your body is a sum total of all of its systems, and they don't work individually. They work all together as one unit. If you have poor nutrition, then of course that's going to create issues with your body getting the nutrients that it needs. And then we also have stress on the digestive system from foods that we eat, fast foods, foods laden with chemicals, things like that, that the body has to not only separate the nutrients out, but also break down into substances that don't harm us. So the main way that this happens is through the large and the small and the large intestine, excuse me. And so when we are looking at functional medicine for a patient, a lot of practitioners will subscribe to the belief, or do subscribe to the belief, that 80% of all illnesses, chronic illnesses, come from the gut. So if you fix the gut, fix the brain, except stuff like that, or you might have heard of a term, fire in the gut, fire in the brain, that kind of thing. And so we want to be looking at all things that are bothering you, so we can make sure that we have all of our bases covered. Now, a majority of Americans have a vitamin or nutrient deficiency. This data is from 2009. Current data has magnesium as the #1 deficiency in adult population, and in the child population, the #1 nutrient deficiency is going to be iron. But generally what we can get from this data here is that anywhere from 15% to 86% of the population is going to suffer from some sort of deficiency in nutrients. There's a lot of reasons for this, and we aren't going to get into that today, but generally, by and large, our food, due to farming practices, over farming, the amount of turnover that we have with our crops, and the types of foods that we consistently eat, which potatoes are the #1 vegetable consumed in the United States, then we have a limit to the amount of nutrients that our body is going to receive. So there's also a term that's very common that people more and more are asking about, and it's called leaky gut. Somewhere people have heard about this, or maybe a friend has something called irritable bowel syndrome. There's different versions of this, but the main premise here when we talk about leaky gut is we're concerned about food allergies, and when eating certain foods causes your body to react negatively to them. And then also leaky gut is also a danger sign for autoimmune diseases, and so lupus. There's a few other diseases as well that are autoimmune based, where the body tends to attack itself, and that's what an autoimmune basically is defined as. So when we say leaky gut, what the heck does that mean? It sounds really bad, and it can be really bad in many cases. But if you look at the diagram we have here, you see that the mucosal cells, or the intestinal mucosal cells on the left, they have normal tight junctions, which means they're very close together, and it does not allow anything more than a simple nutrient to be absorbed through the lining of the intestines to be absorbed into the bloodstream. When the cells become inflamed, they can shrink or become smaller. The spacing between the cells becomes larger, which will allow toxins and substances inside of the intestine to leak through the wall and then be absorbed through the bloodstream. This can create inflammation. This is where the body can absorb substances that are bad for it, creating an autoimmune disease where it will attack itself again, like we've said. And then it also contributes to malabsorption or nutrient deficiencies as well. So there's 10 signs that you may have leaky gut. And the first one is chronic diarrhea, constipation, gas, or bloating. Especially, probably one of the things that I would say that happens most often is urgency to go to the bathroom after a meal, or going to the bathroom many, many times a day. And so that can be different issues, but loose bowels is probably one of the more prevalent indicators that you could have leaky gut, because your body's trying to eliminate some sort of toxin. Nutritional deficiencies, again, can be a sign of leaky gut, because of course you're not absorbing through your small intestine. If you are sick a lot, or you have a poor immune system and you're susceptible to getting sick, that's also a sign. Headaches, because of certain substances, certain toxic chemicals can cross the blood-brain barrier. Brain fog, or just that inability to not remember things, memory loss, sleepiness, those types of things are also an indicator. Fatigue, rashes on the skin, acne, eczema, rosacea. Cravings for sugar or carbs. This is a big one, especially with diabetics or folks that are suffering from a B12 deficiency. That's going to cause you to want to consume a lot of sugar. Arthritis and joint pain due to inflammatory products inside of the body can sometimes settle in the joints, and so that there can be a lot of achiness or discomfort with that. Depression, anxiety, ADD, ADHD. There's a few things here, but mainly when you're having issues with emotions, that can also be an indicator. And then, of course, we talked about the autoimmune diseases, rheumatoid arthritis, lupus, celiac disease, or Crohn's disease. Those are the main ones that we would be looking at for someone that has leaky gut syndrome. So there's also a big push recently with the keto diets, the paleo diets, and this avoidance of gluten or gluten containing products, and everything now has a gluten-free component to it, or a gluten-free version and a gluten containing version. And so this is prevalent in, I would say, a good majority of patients, merely because, as we'll talk about here, the protein that is in gluten is hard for human beings to digest. Gluten is that protein that when you have bread, it becomes sticky. That's why it makes baked goods and bread soft and chewy. Our modern day diet has between 10 and 25% of the daily intake consisting of gluten containing products. And we do not have the digestive enzymes in our gut or in our intestinal system to properly break down these components. So what it allows is, it allows an abnormally large amino acid, and there's several of them, but they cross through the intestine into the bloodstream, and this triggers an immune response. So gluten sensitivity has a lot of the similar characteristics that we have when we talked about the digestion issues. And so headaches, migraine, chronic fatigue in the brain, skin will see acne, eczema, dermatitis. We can have constipation, diarrhea, immune disorders. We can see infertility in females, joint and muscle pain and swelling, and bloating, nausea in the stomach when we eat gluten-containing products. So gluten is contained in wheat, barley, and rye, and the body will, again, react negatively by creating inflammation in the intestine. When we have inflammation in the intestine, this prevents the body's ability to absorb nutrients. What happens is, essentially, we're suffering from an inflammation overload. This is where a lack of nutrients causes metabolism breakdown in the body. So I'm not going to get too deep into what produces lactic acid, but we've heard of lactic acid before. It's what creates that burn in the muscles. But when we have an issue with overloading our body with inflammation, we produce an excess of lactic acid, and that produces the sensation of pain in the body. This can cause chronic muscle and joint inflammation, and inflammation overload is also a cause of chronic pain syndrome. As our bodies suffer from a lack of nutrition or a metabolic breakdown, this can lead to your body having a struggle with inefficiently breaking down glucose. So when we have toxins in our body, it actually forces our body to enter a state of stress, and it will cause the body's energy producing units to inefficiently process the metabolites. And what it does, it speeds up this process and produces more waste products than would normally be happening if metabolism was being inefficient. But it also causes our body to produce less energy, and that energy is called ATP. Again, I don't want to get too technical, but just know that ATP is the fuel for the cells, and when it's inefficient, then we have less ATP available, which would equate to less energy. Over time, this can be a major issue with gluttony, or craving sugar, craving foods in massive amounts, obesity and chronic fatigue. And it has to do with a process in the body called the Krebs cycle. This will cause you to have the need to consume 19 times as much sugar in food, so you make the proper number of ATP units to maintain your ability to live. Because of this, the body begins to store and become inefficient and make our bodies not burn the glucose, but instead it stores it as fat. And this is where we see obesity, or people that diet and can't lose weight. Or somebody will say, well, I just look at food and I gain weight. It causes people to be exhausted. And when we have this type of an issue, you literally cannot eat enough because you have to feed your body to keep it alive. And it's really a dwindling spiral, because unless you take a certain procedure or certain sequence of steps to get yourself out of this, it literally can be nearly impossible to overcome. So when we are under stress, we have these little glands sitting above our kidneys called the adrenal glands. And these are the glands that will kick in when the body is under any type of stress. It's also a backup energy producing system. So if you are not metabolizing the foods that you're eating properly because of inflammation in the gut, then your adrenal glands are going to kick in. And it's also going to cause your thyroid, which by the way are both hormones, they're going to move sugar out of storage, and it's going to get your body to go through something called glycolysis. The system can be very easily overloaded. And what it'll do is it will cause your body, or cause you to feel exhausted, which will lead to, again, an increase in the number of lactic acid units, leading to chronic pain. And then you also have a very hard time with your body getting rid of inflammation, because one of the functions of the adrenal glands is to help your body fight inflammation. And over time, this can lead to arthritis. So now we have an issue because our hormonal systems are being overtaxed, and your thyroid gland and your adrenal hormones, they're only meant to be released for short period of times when stressful events occur. If you have an issue where these are being forced to be released constantly, meaning the thyroid and the adrenal hormones, then they can actually destroy your health. And these two hormones can be a major cause of someone developing diabetes. There are some causes of adrenal malfunction. First one being chemical. So this can come from your diet, it can come from nutrient deficiencies. You can have toxicity, which again is one of the main themes of today's talk. And toxicity can come from drugs, food, the water, your environment, like we've already talked about. And then another one that isn't always considered is nerve trauma. So you could possibly have nerve interference to your adrenal glands. You could have an issue with your spine, where maybe your spine is out of alignment or something like that, or you've had an issue to that area that's caused damage. So the three main causes, again, chemical, toxicity, and nerve trauma. So today we're talking about chronic illnesses, and diabetes, if you remember, is considered a chronic illness. I'm not going to go into this too much, other than it does relate to the adrenal malfunction and the thyroid and inflammation slides that we've just gone over. But we look at the A1c, and if you've ever had this test done, then you know that it is an indicator of whether or not you have diabetes. If it goes over a certain number, typically if it goes over 6, then you're going to be considered a diabetic. But fixing this can actually mean the difference between life and death. Getting that A1c to come down can mean the difference between life and death, because if you have too much sugar in your bloodstream, not only does that cause inflammation, but it also blocks your body's ability to circulate oxygen throughout your body. Now, oxygen is one of the ways that your body uses that Krebs cycle to metabolize certain nutrients that you take into your body. So again, diabetics will very frequently suffer from lack of energy, low energy, and again, a need to consume high levels of sugar. And if we don't fix the A1c and get the oxygen level to come up and the sugar level to go down, that can be an irreversible condition, and that can actually be very life-threatening. The way that this happens is when you have too much A1c, again, when it goes over 6, you can see in the center there's a red blood cell. And what's supposed to happen is as you move through the diagram here, you see that where it says the oxygen is blocked, those little white dots indicate sugar. And so there should be a certain proportion of sugar to oxygen, and it should mostly contain oxygen because, again, every cell needs oxygen to survive. But when the sugar attaches itself to the A1c molecule, the sugar for the entire 120-day life cycle of that A1c molecule, that sugar will not leave that cell. Now, as you breathe in oxygen and the A1c goes past your lungs, you have a reduced ability to attach oxygen to the A1c molecule, so you have an oxygen poor environment. This will starve your body or starve the cells of oxygen. And typically this will start to happen below the knees, but you'll start to get something called peripheral neuropathy. You'll get a tingling, a numbness, a burning. You'll have wounds that don't heal. And again, you're also going to suffer from issues with energy and obesity and things like that. This has become such a problem that about 19, 20 years ago, the government looked into stress and chronic stress, and they've also looked at the part of the brain that controls the adrenal glands. This can cause an over-release of the hormones, and if you have an issue with the hormones and they become unable to manage your blood sugar, that can be the most single detrimental factor in avoiding diabetes. It's also very common with inflammation, like we have mentioned, to suffer from arthritis. And incidentally, diabetics also suffer from a high amount of arthritis as well, because typically diabetes happens to be a disease that has an incredible amount of inflammation and toxicity associated with it. So arthritis and inflammation go hand in hand. A lot of times this can produce things that cause nerve interference or nerve irritation. Radiculopathy, which is going to be like a sciatic pain, or sometimes you get a shooting pain down your arm. You can get neuropathies where you have that lack of sensation in your feet. And then it's also common because of blood vessel inflammation to get malfunction in the vascular system. So we would see red or a purple color to the feet. We could see varicose veins. The feet can be hot or burning, or maybe cold, but they're warm to the touch. There's all kinds of different issues that we see with vascular malfunction. But again, most of this is all due to having too much inflammation being produced in the body and not being able to get rid of it. We also see joint problems in the hands, and this is a big one because patients will have large joints. You can see in the diagram there that with osteoarthritis that the joint is misshapen, and there's a healthy joint there. You can see that's nice and smooth, and there's cartilage that's allowing the joints in the extremities to move properly. But patients can develop rheumatoid arthritis, which we said was an autoimmune disease. We can also have osteoarthritis, which is an age-related or joint damage-based arthritis. But this will affect the cartilage, the ligaments, the tendons, the capsules that surround the joints. It can affect the bones and also the muscles. So just to quickly review what we've just gone over. The reason people are sick, number one, is because of toxicity. Number two is going to be because of digestive and absorption problems. Number three is going to be leaky gut. 4 is going to be vitamin, mineral, enzyme, and amino acid deficiencies. We'll see the body eventually, because of this, go through a metabolism breakdown, which will lead to inflammation overload and excess pain units. When we have less pain units or too many pain units being produced and not enough energy units, then we're going to go into chronic fatigue, which is going to then set off our body into adrenal exhaustion, because that is going to make our hormones try to compensate for this, and eventually those hormones are going to burn themselves out and not be able to produce anymore. This will all lead to chronic pain and fatigue, as well as we can start to see nerve traumas or nerve traumas affect this system. We can start to see disc involvement in the neck and the lower back, and so we get degenerative disc disease. We can see bulging and herniated discs. And then we move on to having excess blood sugar and blocking the oxygenation of the cells. That will also lead to neuropathy, nutrient deficiencies, and nerve traumas. We see joint breakdown from all of the above, and this is how we end up with a chronically sick person or the average American these days. So really what we want to move on to now is what we're actually going to do about all of this. So that's basic background information on what is causing a lot of these ailments. So really where the interest now should be is in looking at how to. So the term functional medicine, you've heard me use that term a couple of times today, and there's quite a few different ways that this can be approached. And in our office, we have seen this evolve through just helping patients with arthritis, which is originally where our practice had originally started, was in arthritis and pain management. And that progressed, of course, into wanting to find out what the underlying cause of this is, because that's almost always a question. So that's prompted our medical staff and our chiropractic staff to start to learn more about how the body functions and how we can unlock the keys to some of these doors. So when we invite a patient to participate in a functional medicine program, this is going to be an individualized approach for every single patient that walks into these doors. 10 patients will have 10 different symptoms and 10 different ways that we need to treat them. And so just a general description of functional medicine is it's an individualized approach to disease causes that is based on the evolving research in nutritional science, genomics, and epigenetics. Now, this doesn't mean that we are treating diseases specifically, because again, we're looking at the body as a whole, and we are not intent always on treating a specific disease. It's customized again for each individual patient, as I just said, and we're looking for the underlying cause and not just the treatment of symptoms. So some things you can do at home to help with leaky gut if you feel that you're suffering from this is you need to eliminate gluten, dairy, soy, refined sugar, caffeine, and alcohol. You'll also want to look at eating fish, especially fish that has a high proportion of oil. Also coconut and olive oils, avocados and flax, and you want to make sure that you take probiotics. Many people are going to have a limited amount of success with just trying a few elimination type of diets, and most of you are going to have to look at using a functional medicine approach with our licensed professionals, of course, if you're listening to this talk today, and we have experienced medical professionals that know how to help you overcome these issues in a quick and efficient manner without trial and error. The main organ in your body that's responsible for detoxifying and eliminating harmful substances from your body is the liver. So it goes through a series of steps or phases. So there's two main phases that your body will break down these toxins. But essentially what your liver is trying to do is they're trying to take these substances and turn them from what we call a fat-soluble toxin into a water-soluble toxin. This pathway, or the detoxification pathways, will, once they're converted into water-soluble chemicals, they will allow your body to pass these fluids out through your bile or your urine or your bowel movements. So there's two phases of detoxification, and in phase one, it's the first series of steps that starts to transform the poisons into toxins that can be removed. This is going to require the B vitamins, magnesium, calcium, and glutathione mainly. And as we get into phase two detoxification, this is the final series of steps. This will use amino acids and antioxidants that will neutralize the toxic chemicals, and this will require B12. What incidentally happens in some people, especially if you've ever drank alcohol, is typically if you consume alcohol too quickly, and it's approximately an ounce of alcohol per hour that your body can detoxify. If your phase two, which is breaking those toxins down to be eliminated, is slower than phase one, then you become toxic or inebriated because you're actually overloading your liver. So alcohol is definitely something that you have to eliminate or avoid if you are suffering from issues of chronic illness or inflammation. So we have to fix the phase one, we have to fix the phase two detoxification pathways, and we have to fix leaky gut. Now, there is a specific liver detoxification shake that we have that can help you with this process. It is stimulant free, it's allergy free, and it contains the essential nutrients for phase one and phase two detoxification. It is also going to give your intestines a break and allow it to heal while we are improving your body's ability to eliminate toxins. It's very easily digested and absorbed. It also allows your body to balance its pH levels. Most people that are inflamed or suffer from chronic pain are going to have a pH that is lower than 7. You want the body's pH to be somewhere around 7 to 7.2. Now, your blood type is irrelevant for this because, again, all blood types need to be able to detoxify properly. So it doesn't matter what type of blood type you have. It's approved for all blood types. In the beginning, your program with us, what sometimes will happen is your liver is so toxic that it's actually spilling its toxins over into the large intestine. And in those cases, we have to do something called IV nutrition or parenteral nutrition. What this does is this allows your body to detox and repair by avoiding the intestine and the digestive processes, which will take approximately a month. So IV nutrition allows direct absorption into the blood, which will then allow direct absorption into the liver. And bypassing the digestive system is very key to giving the liver a break so it stops causing the issue and spillage over into the intestinal system. So there's specific IV nutrition that we use in the office for the patient who's suffering from chronic inflammation or chronic disease. And there's 6 precise steps, but again, the first has to do with cell repair, detoxification, and cleansing. And the second step is going to be boosting the immunity, helping the body get rid of free radicals, which of course will be done with antioxidants, and then also providing a shield for toxins so your body can build up its own defenses. We also want to look at DNA rejuvenation and energy boosting. And then, of course, if you have any issues with nerve trauma or nerve repair, then we want to make sure that we are oxygenating as well as stabilizing the blood sugar to produce as much oxygen in the bloodstream as possible. And then we move on to helping the body deal with stress and also maintaining its antioxidation capabilities. And eventually we're going to be looking at anti-aging, at weight management, and balancing your hormones once your body is now properly functioning again. What's in the IV nutrition are going to be the nutrients for the first steps of phase 1 detox. There's going to be nutrients that are needed to stop the free radical buildup during phase 1. And there's also compounds that break down fat to release the toxins and poisons so they can be removed. This will help maximize the phase 2 conjugation so that we can remove all of the toxins and none of that gets hung up in the liver or in your bloodstream. We have nutrients for nerve ending repair and blood sugar stabilization. And then, of course, we have hormone balancing to restore metabolism, to maximize energy production, help your body reduce pain units, and relax the adrenals. So again, we're fixing the metabolism and helping the body replenish what it's lost by detoxification and IV nutrition. And we give to the body the precise nutrients to maximize the body's energy cycle, which in turn help to maximize the energy units and to minimize the pain units. If we can reverse inflammation overload, now what's going to happen is you're not going to be producing 19 times as many pain units, which equates to you not being 19 times as hungry or filled with 19 times as much garbage. And you're going to feel fresh and whole. And a lot of patients will say they feel new or reborn again after getting a few weeks into the program. The main thing that we have now is the body restoring energy And so we're correcting the metabolism cycle, and you'll be producing 38 energy units for 1 sugar unit. And the ultimate effect here is going to be an increase in energy and restoring the body's ability to thrive. You'll have more energy, you'll feel more active, and that's going to open the door to exercise and long-term recovery as well, because you'll feel like doing these activities again. So now we've got the adrenal glands starting to get happy again because your body's energy is coming up, and we can now correct your metabolism cycles, and we can put the adrenals on low power mode, and they can relax and rebuild themselves. They'll get stronger and stronger. All your functions will start to improve, and your anti-inflammatory response is going to get better. So now it starts to maximize itself, and we get even more inflammation, even more arthritis, and more pain is removed from the body, and your body becomes more stabilized. So remember, one of the causes of adrenal malfunction is nerve interference. So we want to make sure that we restore function to the nervous system by finding and removing any nerve interference that exists within the spinal column. Also remember that one of the main chronic illness diseases is arthritis, and many times this is going to involve spinal arthritis, especially in the discs, or something called spinal stenosis, very simply termed a pinched nerve. But with decompression, we can repair and correct discs and stenosis by rehydrating the discs, and this can also be greatly enhanced with regenerative medicine injections. And so we do have a separate webinar as well on the concept of stem cells and how your body can heal with that type of technology. We also want to make sure that we repair the nerve endings and the cells. Mainly, we're looking at increasing the oxygenation to all cells of the body, and also reducing and stabilizing the blood sugar. Laser therapy is a device we use in the office that aids in the healing of the nerve endings and the cells that have been injured by anoxia and neuropathy. And this is a way that we can bring oxygen to the tissues with increased blood flow, and this is placed locally over the area that is being treated. So now we have the new you. And this is a vision that we have for all of our patients. And so I'll simply just read this. And I know it's long, it's a run-on sentence, and it makes no sense. But really, it's just a vision for a patient that is happy, healthy, vibrant, no longer inflamed, has tons of energy, is out of chronic pain, has a restored hormone balance and strong energy reserve, who has an abundance of nutrients, a strong metabolism, a fully restored liver with powerful detoxification potential, a repaired nervous system, and totally normal digestive system with in-range blood sugar, oxygen flowing to all cells of the body, suffering from no neuropathy, no joint pain, no muscle pain, and someone who pops out of bed every morning because they can't wait to start their day. So if this is something that has some interest to you, or something has spoken to you and you want to sit down and talk with us about a problem that you may have that you think functional medicine might help with, then we would like to offer you a gift of health. This is an opportunity for you to sit down with our medical team. We'll spend approximately an hour with you. It is a $200 value, and so it's a free consultation. There's no charge to you. And this will allow us to interview you, talk with you, learn a little bit about you, and for you to get your questions answered to find out whether or not we can help you. It does include a consultation and examination, and this will help us find out what you've done to injure your pancreas, your adrenals, find out how toxic you are, go over things like leaky gut, determine if that's your issue, or gluten sensitivity, or any of the things we talked about today. But mainly what we're looking at is that bodies break down because of injury or abuse. And if we can find out from your history and in talking to you what you've done to lose your health, then we can develop a plan and a way to recover that. It's a very thorough consultation, and it's going to also include some very simple testing that is not painful to help us determine if we have a need to help you or if we can help you. The reason that we do offer this gift is because we don't want anything to get in the way of finding out if we can help you. Our purpose is always to help as many people as possible, and we don't want there to be any barriers to gaining access to our medical team. So that'll conclude our webinar for today, and I really sincerely thank you for listening in today and spending the last 40 minutes with us. If you would like to contact us in our Temecula office, we are located at 27699 Jefferson Avenue, Suite 210 in Temecula, and then we also have our Hemet office at 901 South State Street, Suite 100. The number is the same to reach us for both offices, and that is 951-225-4419. If you call that number, we will route you to the correct office and book your consultation accordingly. I do thank you for tuning in today, and everyone take care. Thank you very much.